Assalamu alaikum and welcome to another edition of Ramadan for Better Health. Today's health topic, we're going to be discussing a mental health issue. This has to do with the deterioration of our mental well-being. We're looking at mental impairment. We're joined by a doctor in geriatric medicine. He is a consultant in this area, Dr. Muhammad Khatar. Assalamu alaikum to you, doctor, and welcome to the program.
Assalamu alaikum, and thank you very much for inviting me.
So this subject, mental impairment, you're a specialist in geriatric medicine, providing health care for people, a special group of people who are above the age of 60. I imagine that there's some mental health issues that can arise in this population. Can you talk about those and then bridge that to the general population?
Yes. With age, there is a possibility that our mental activities and function started to decrease a little. So we can start to complain of memory impairment. We have some memory problems. We sometimes have slowness to recall the names of persons we know before. These issues usually not affecting my function. For example, if I am 70 years old and I am a doctor, I may have a little memory impairment, like I'm not well to remembering the patient name, but if I read his file, I remember it quite well, and I can treat him very well. And this is just, we can say, it's age-related memory impairment. It's some memory impairment, minimal, which is related to aging.
So there's, as we age, there's an expected loss of memory.
Yes,
we should
minimal
all,
loss of
okay,
but there is.
And this is different from, you know, maybe we, like you the example you gave, we forgot the name of someone we just met, this kind of thing. That we're talking about a different type of condition.
Yes, there is different causes for memory impairment. Depression can cause memory impairment. Hypothyroidism, decrease in the thyroid gland function, may cause memory impairment. B12 deficiency can cause memory impairment.
Deficiency of?
In vitamin B12
vitamin
level.
B12.
And sedating medications may cause memory impairment if we use excessively or wrongly use sleep pills. This may can cause memory impairment. So there are many causes for memory impairment. One of them is the age-related memory impairment. There is also a famous cause of memory impairment, which is Alzheimer's disease. Certain types of brain changes that happen, which cause severe memory impairment.
Doctor, you know that we are increasing in our global population. The numbers of Muslims are increasing throughout the world. We will soon be the largest religion in the world in the next few decades. And we have a number of, this is due to the fertility rate within Muslim countries, but also people in non-Muslim countries are embracing Islam. People embracing Islam from Western countries, maybe they had been consuming alcohol before they came to Islam. Can you talk about the long-term effects of alcohol, maybe some light street drug use? Can you talk about how that can contribute to memory impairment in older age?
Yes, the long standing of alcohol or drug abuse may cause a decrease in the brain function and also decrease the blood supply for the brain, which is end with decrease in the mental activity. However, with stoppage of these issues, we can say that we stop the problem, and probably we will face better memory than if I continue drinking these issues or using these issues. So it has an effect, of course, but still stopping this offensive drugs or alcohol is very beneficial for life.
So we see the wisdom behind Allah prohibiting alcohol and these other mind-altering substances. And alhamdulillah, we have people taking shahada, embracing Islam, and eliminating this from their bodies. Doctor, can you continue to provide more distinction for us? Help us to better understand the difference between the normal memory loss that we can expect and the kind that is attributed to old age. And also, if you can talk about traumas to the head.
Yes, okay. Normally, with age, as we have just mentioned, we have some times of decrease in the memory, decrease in our memory. But this memory impairment is very minimal. It should not affect our function. So if a housewife is working in her home, she can cook well, she can clean the home well, she can do the financial issues in her home well. So she has no problems at all. But she sometimes forget a little stuff, where I put the money, small stuff. A merchant who used to buy and sell, if he has some age-related memory impairment, he may forget a little stuff, but his job won't be affected. The problem if our memory impairment becomes severe enough. If this memory impairment becomes severe enough, it won't be a normal with age. It will be a disease, like Alzheimer's disease, or like head traumas, or like brain tumors, or like different types of disease. If it is affecting the function, if the function is affected, for example, if this housewife can cook well, when her daughters or sons eat her food, they found that it is very salty, because every time she puts salt and she forgets that she put salt, she adds salt, for example. Or she cannot manage the financial in her home. She is not remembering if she pay the money to those who giving her food and stuff or not. If she cannot deal with these issues, if she cannot cook, if she cannot clean her home because of this memory impairment, so this we consider it a big problem and must be go to the doctor to be treated.
Now, we hear a lot about Alzheimer's disease. Can you talk more about what is Alzheimer's is? Is it something that comes out naturally? Should we all expect it? Is it genetic, lifestyle? What is Alzheimer's?
Okay. Alzheimer was a German scientist, doctor, who discovered a disease which is related to our memory and mental activity. He discovered it more than 100 years ago. He found that some people have memory impairment. It's not related to age. It's more severe than just we have just mentioned. This memory impairment affecting their function. And they also started to develop changes in their mental activities, like they may have difficulty to remembering the names, or they cannot remember the name, or not knowing the objects, what we use this object for, like pen. They don't know what it is. They just think that this is a piece of plastic without knowing its use, for example. Impaired judgment. People cannot judge well. People cannot plan to their life or cannot execute.
How about the identity? I hear a lot of times they forget the faces or names of their own family members.
Yes, they forget the name. They cannot realize their family members in the late stage of the disease, or their son. So this problem, Alzheimer, call it's a dementia. It's a type of degenerative brain changes. It's a type of disease, broad spectrum of disease. He later on, the scientist gave the name of the disease to Alzheimer, according to the one who discovered this disease. And when we diagnose a patient with this disease, Alzheimer's disease, so we have to make sure that this patient is properly diagnosed. It's not due to, for example, a brain tumor. This memory impairment is not due to other causes. It's not due to vitamin B12 deficiency. When we make sure that this is the proper diagnosed Alzheimer's disease, so probably the patient's function will decline gradually with time. His memory will decrease more and more with time. he will, at the beginning, he will forget the things that happened recently in the day. Late in the disease, he will forget the recent events and the old events. Like we have just mentioned, he will find difficulty to recognize people, impair judgment.
I've also heard these patients sometimes venture out of the home, maybe for an errand, and forget how to make their way back to the car or forget how to get home entirely.
Yes, these patients have impairment in their ability to recognize the direction, and the whole buildings in the streets look the same like them. They cannot recognize the characteristics of their home, so they easily lost.
Okay. This is Dr. Mohammed. We're talking about memory loss. Right now we're discussing Alzheimer's. We'll come back and continue our discussion with the doctor after a short break.
Every year during Ramadan, a lot of fiqh questions being raised, such as, what happens if I swallow some water by accident while performing wudu, while fasting? Would that invalidate my fasting? Is it permissible to brush my teeth while fasting? And the sisters who ask, is it permissible to taste the food while cooking? While fasting, would that invalidate my fasting? And of course, not to forget the typical debate every Ramadan with regards to Taraweeh. 8 rak'ahs or 20 rak'ahs. Shall we make the qunut before ruku' or after ruku'? The witr prayer, is it 1 rak'ah or 3 altogether? These questions and many others will be answered insha'Allah during our program Ask Huda, which will be aired during Ramadan every week from Sunday through Thursday, exactly at 5 p.m. Mecca time sharp. You can simply call in to drop your live question, or you can send your question in advance to my page, Dr. Muhammad Salah Official. May Allah the Almighty accept our fasting. May Allah forgive us our sins, and may Allah guide us to what
Assalamu alaikum, and welcome back to the program Ramadan for Better Health. Today's topic is dealing with memory loss or memory impairment. We're joined by Dr. Mohammed. He is a specialist in the area of geriatric medicine. Doctor, before the break, we were talking about making a distinction between the common slight memory loss that we all go through in life, forgetting where we put the keys or the name of someone that we just met, and a more serious memory impairment associated with more serious kinds of brain changes. Do you want to say more about that before we continue our discussion?
Yes. I want to make sure that every one of our audience realize the difference between age-related memory impairment,
Yes.
which is not affecting the function. It's very minimal, very mild. Doesn't affect my daily activities. Doesn't affect my financial issues. I'm performing well through all the day. And the other issues, which is Alzheimer's dementia, Alzheimer's disease, is a severe form of memory impairment and mental impairment that really affect the patient's function. He cannot deal with money. He cannot deal with any financial issues or any social events, and this is really handicapping disease.
Yeah, very serious.
Yes.
Okay, so thank you for making that very important distinction. And just because we happen to be an elderly person and we are a bit more forgetful than we had been in previous years, it doesn't mean we have a mental condition.
Yes.
And we should, there are more serious things that we should be looking for in consultation with our doctors.
Yes.
We also were talking about Alzheimer's. You told us that this was a name of a German physician.
Yes.
Who discovered and did some work, some early work. He was a pioneer in this area.
Yes.
But we didn't yet get to evaluating, detecting, investigating, and treating Alzheimer's. Can you address those things?
Yes. With Alzheimer's disease, the patient started to decrease his mental activity. The patient started to complain of decrease in his mental activities, very gradual, progressive throughout the years. However, up till now, we don't have any curable disease for Alzheimer. Most of the medications which is available start to decrease the progression of the disease. For example, if the patient is his memory impairment is getting worse very quickly, it won't happen like this. It will getting worse bit by bit, slow. But there is no disease which can stop. No medicine which can stop this disease.
Yes. And just to recap, doctor, this particular condition, is it that the nerve cells are dying, the brain cells are dying? Is that what's happening?
Yes. It's the brains. We are in this disease. We are losing the brain cell very, very quickly. It's a very distressing disease.
A quick question and this could be related to your answer about evaluating. Do these brain cells die in a particular region of the brain, or can it be in any part of the brain?
Yes, it's done in certain areas in the brain cortex. Then it started to involve the whole brain, and it's and the losses in the whole brain.
So it started
with the areas related to the short-term memory.
Okay.
Areas which is responsible for short-term memory.
Is this near the center, the stem of the brain? Or?
No, it's in the periphery, in the temporal, in the hippocampal areas.
Okay. All right. So can we talk about how you said that there's really no way to stop it medically.
Yes.
Once it starts. And so you said that the medicines, the treatments are targeted at slowing it down.
Yes.
Is that right?
Exactly. That's why we have to invest in our memory to protect it from aging or protecting from this aggressive disease. For example, we have to keep our brain active. We have to encourage doing more social activities, reading more. We have to encourage our family members to do creative activities, go read more, revise what you memorized well in the Quran before, go have some productive activities. Even during our early life years, those who concentrate well in class, they use their brain well. And those who didn't concentrate well, they don't use their brain well. So using it well it protect our brain in the future.
Mm.
Also, learning new language in the youth is very protective from Alzheimer. And the most important issue, if we have any chronic disease which is related to blood supply of the brain,
Mhm.
like diabetes or hypertension, this chronic disease has to be well controlled to prevent our brain from facing a problem with decrease its blood supply.
I have a question about the activities. What about breaking the routine, the daily routine that we have? We get up, assuming that we're retired, we don't have to go out and spend 16 hours a day outside the house. What about traveling, performing Hajj, the Umrah, breaking our usual routine? Can this help support the mental health of people who are suffering memory loss?
Yes, yes. Any mental activity, any physical activity is very, very important for our health.
Mm.
And if we are very stressed, I really encourage those who are very stressed or those who are very boring routine of life to change it every now and then, like going for short trips or have a walk with a friend. This really increase the mood and increase catecholamines and norendorphins. It's brain substance. It's increased in the brain, increase the mood and increase the concentration and increase the memory.
By walking.
By walking, yes, and doing any physical activities. And of course, short trips like going abroad or going to Hajj or Umrah is very refreshing and has very relieving effects to the stress that we face. It's very, very important, yes.
I imagine, I guess, I don't know, that you can scan the brain and see the deterioration. What about the blood? Does the blood give you any useful information for diagnosing?
Yes, there is blood markers that can be present in the Alzheimer's disease, but however, it's for research use. We don't do it in the clinical practice.
I see.
And also, if we scan the brain with complicated devices, we can detect the disease, but it's all of these are for research use.
I see. Okay, so we've addressed the issues of detecting and treating. What about diet? What role does diet and the food that we eat, how does it promote general mental wellness and memory? Are there certain foods associated with promoting good memory?
Yeah, thank you very much for this question. Yes, there is definitely food. There is food which improve memory. Red or purple color foods is very helpful for memory, like
Purple?
Purple, yes. Like berries, like red and like orange, like once we say it, try to help me. Fruits or vegetables, we say red and purple in color.
So like apples? Red apples?
No, apple is white from inside.
Oh, you mean
yes,
the meat?
Red,
not the
red,
skin.
Yes, red grapes, very helpful.
Red
Berries,
peppers?
Peppers, yeah, thank you very much. Yes, pepper, tomato,
Okay.
and rumman.
So things that are in the red spectrum, red and purple.
Yes.
We have purple cabbage, for example.
Yes, very, very protective. Also, drinking plenty of water is very protective, and fish is very helpful, and which is very rich of omega-3, very helpful for the memory. And whole grains, the whole grains is very important. Wheats and its products containing high amount of fibers and vitamin.
Oh, how could I forget my favorite? One of my favorites is beets.
Yes.
Beets, you know, this food, you slice it, it's so rich and deeply red.
Yes.
So would you also include beets
Yes,
in?
yes,
Okay,
yes,
so
yes, of course.
so good. This is a very good, and we've also touched on a little bit about the importance of walking, breaking the routine, doing short trips, and if we can, perform the Umrah or the major pilgrimage, Hajj.
Yes.
And I think also the month of Ramadan, it gives us increased opportunity for social engagement.
Yes.
Can you talk about how Ramadan can help us in this regard to have better memories and better mental health?
Yes. Ramadan is a chance to change the routine. It's a chance to read with concentration in your Quran. It's very important for your memory, and concentrate while you are praying. It's very important for your memories. Social events, which is highly related to Ramadan. It's relieving, decreasing stress, improving the memory, and also the physical activities that we do in Ramadan is very helpful. Going more to the mosque, walking more, and doing more effort with prayer. Yes.
Yeah, Allah, the wisdom, again, we see Allah's wisdom in giving us this obligation as Muslims to perform Ramadan, being more active.
And it's a chance for detox, removing of the all toxins that we have in our bodies during the fasting, and refreshing our whole body functions.
You mentioned red and purple things.
Yes.
Can you mention a few things that work against the things we should avoid?
Yes. No, thank you. High fat. High fat is very, very annoying for the blood vessels, because it can cause atherosclerosis, which is stiffness and narrowing of the blood vessels. So the blood supply to the whole body will decrease, especially in the heart and the brain, will affect our concentrations and memory with time. Excessive nicotine intake, cigarette and alcohol, of course, this causes blood supply to decrease in the brain. And usually heavy meals make most of the blood go to the stomach, so there will be little amount of blood going to the brain, will decrease the... That's why we advise people not to take heavy meals in the breakfast during Ramadan. Take light breakfast and distribute their food throughout the time from fast to suhoor, so they can be mentally active throughout the day.
Yes.
In Ramadan.
Okay. Thank you so much for joining us to talk about memory impairment and how the things that we can do to promote better memory. Dear viewers, thank you for joining in and listening to the program. We hope it was beneficial for you. We've been talking with Dr. Mohammed Khater. He is a geriatric medicine consultant here in Cairo, Egypt. Inshallah, we'll be back to discuss more health topics. For now, we'll say Assalamu alaikum wa rahmatullahi wa barakatuh.